Hello, dear colleagues. My name is Mynzhylky Berdikhojayev, and my assistant Ravan Maratullah, together with our resident Sagnish from Aktobe city, and today we are from Almaty city, Kazakhstan. Case number 1, and it's the only case for today for the streaming. Yesterday we had a couple of cases, but we couldn't stream for some reason, and this patient came for us for the checkup. It was planned checkup, and during the checkup this ICOM aneurysm, A1, A2 aneurysm on the right side was found. The aneurysm size is 2.3 by 2.4, and there is a ICOM, and we can see the contralateral ACA. Vertebral basilar system looks normal. This is aneurysm, and small kink on extracranial side, and this is the aneurysm. Let's measure. Yes, and this aneurysm is non-ruptured one. Let's measure it. Yes, we can accept. It's nearly 2.5 by 3.3. The coil size we will use 2.5 maximum, but it should be 2 by 8 or something like that. And let's measure the artery. We have two options in this case. The option number 1, it's a balloon assist coiling, and option number 2, we have flow diverter stent Silpista baby. It also could be used in this case. Unfortunately, we have no any other intracranial self-expandable stents like Elvis Evo, Leo baby, Credo, Pegasus, nothing else. It's just the beginning of the year, and I think in many places in the world the situation could be different. Could be various situation, and I think this is a working position. Yes, it's look like this, and I think we can do balloon assist coiling for this aneurysm. We choose gamma 17 with the Chikai black and Eclipse double lumen with the Traxxas wire inside, Traxxas 1214, regular Traxxas, and I think the balloon assist coiling should be okay. Yes, on the left side patient has a good ICOM, and the left PCA territory mostly supplied by left ICOM. Now we are here. Yes, it's nearly position like this. Okay. Unfortunately, in our medical system we have some issues with the financial support from the government, and in Almaty the case numbers are decreased twice. It's twice decreased. That's why we will do less and less cases from Almaty, and maybe we will start to do live cases, live stream from Astana. We will see soon. We will discuss today with Evgeny. Maybe we can do live streaming from the Canon Andrew Suite in Astana. You have seen that Andrew Suite during the last Neuradict forum in Astana. We will see. Okay, it's a twice decreased number of cases in Almaty. Last year it was nearly 500 cases, and for this year we received only 255 cases. That's why I decided to come not every weekend, just if it would be complex case, or it would be if it would be a request from the patient or hospital administration to operate the patient in Almaty. And now I can spend I hope I can spend my weekends in Astana with my family, but it's just beginning of the year, and maybe something will be changed. We'll see. Yes, the introducer sheath is short. It's a 11 centimeter introducer. And guiding catheter is Hyperion coronary guiding 8 French with the unical guide wire, hydrophilic 035, with the bolt Y connectors Riva and Riva Lure. This is Riva, this is Riva Lure. And we have this is unical from Asahi. This is Gamma. Gamma is a bolt micro catheter, and because of the beginning of the year, we have only Gamma. Yes, it's for this anatomy, Gamma is suitable, and I hope it will work. Ekranda 1 centimeter bizden tartasan şu. It's in Kazakh. I'm talking in Kazakh. I can speak Kazakh. I can speak Russian fluently. It's my second language, and also we are talking in English. And some words I know in German. I tried to study German because I visited Germany several times. First time in 2011. I stayed in International Neuroscience Institute in Hanover in 2011, together with my family, with elder son. He was 1.5 years old at that time, and with my wife Laura. And then I visited Germany during my visit, Essen visit in 2012. It was in October, 3 weeks. I call that time the gold time of my career. I learned a lot from René, and nowadays my practice is a mix of practice of René and Shimon Maimon from Israel, Tel Aviv, and I started endovascular with Maimon, and then I went to Jerusalem. I stayed with Jose 10 days, and then it was a Essen time. I learned a lot from Maimon, Jose, and René, and then I never visited Bicêtre or Rothschild. I visited Rothschild at the time when Michel Piotin, and now he's there with Raphael Blanc. but I never visited place of Laurent Speel and Professor Moret. I couldn't visit. I visited only a Link conference several times. Yes, and I visited Limoges once. I spent a couple days with Charbel Monet. Yes. And my practice really changed after that visits. Yes, it's a Kazakh practice. We can call it Kazakh practice because it's mixed, remix. This is Rowan and Sagnish. And our operating nurse is Madina. Our Y connector system. And anesthesiology team led with Aslanjan, and the video stream supported with the Evgeny. He's our old friend and partner in live streaming. Қандай операция болды? Крайний фикстур. This patient were operated on meningioma in 2014. Meningiomасына кезінде aneurysm анықталмаған ба? Yes, at that time it was no aneurysm, and she were operated in Germany 10 years ago, more than 10 years ago. And now let's have a look. And I couldn't see the blush from the tumor. I think everything is clear. Yes, it looks clear. With the control CT, we can see the CT with contrast enhancement at the end of the operation. We can check the meningioma place, but on MR, I think there is no meningioma. No? Там же нет менингиома сейчас. Бастазола? Yes, it's clear. Yes, I should do the decision to come less to Almaty, and from last week we made a decision to leave the team mostly by themselves, and they will do cases more and more. But last year, from 500 cases, my experience in Almaty was 290 cases, nearly 300 cases. It's 60% of the case volume in Almaty, and in Astana I also made more than 250 cases, and another more than 50 cases during my visit in regional hospitals, and during my visit in Tashkent, together with the Medicover team in emergency hospital, in Shoch Medical, and in other different hospitals like Aqua Midline. Okay. Yes, and now we will need the infrastructure in Astana. Так, 18 ғой, не? 18, 21. Right 18 and caudal 21. This is especially for caudal. Caudal 21, right 18. Okay, it's touching the second one. Right 18. Yes, and you can hear the Surah Baqarah from Quran. It's like a music in Essen, but I couldn't use the same experience from René. He's listening to music during the operation, but I couldn't do the same, as René is unique and he knows every song he's listening in the operating room in Essen. And for us it's a little bit support from the sky, from the God. I think not so little, will be huge support. Okay, that's the maximum magnification. I did the last radiation, and on this system we have no clarity. That's why it's a little bit more radiation. And the touch screen module on Philips is not working. It was broken in September and till now it's not working. Назад. Вперед. Назад. Назад. Stop. Stop. Yes, the aneurysm with this irregular shape, and it's ICOM region, and this kind of aneurysms is mostly rupturing during the follow-up. That's why it's indication for the treatment. Yes, I'm doing small 4 screens because I need to control the unsubstructed view. As in many places, it's a so-called Eurosport like screens, big screens, but for me it's suitable to see the substructed and unsubstructed at the same time. I think the wire is lost the shape. The Traxxas is a soft one. Okay, that's okay. There is a lot of perforators we need to keep in mind. That's a contralateral side. No problem. We need to go to A1 segment and then we can rotate and can pass the aneurysmal segment. No problem. It should be aneurysm. Okay. This angulation is quite big. Oh, it's no problem. As from this point we need to rotate, and as it's all the time, we'll try to go to the aneurysm. Okay, let's stay here. Maybe we'll change the Traxxas for Chikai Black, and Chikai Black is more shapeable. Now the gamma is coming. Okay. The traxer is inside the aneurysm. Yes, now we change the anatomy and okay, let's place the gamma inside the aneurysm, and then we can use the same Checker black to navigate the eclipse balloon. Okay. It's quite stiff instrument. Okay. It's touching the wall, that's why it's not so comfortable situation. Okay, let's fix it. Now we can take the access, and first of all I will try to First of all I will try to reshape my traxes. Thanks to double lumen of the balloon, we can take out the wire and we can reshape, and we can go. Okay. It's a little bit mistake. I took a shaper of Checker black, that's why it's more acute angulation, more bigger angulation. Yes. Like this. Let's try. Yes, I have seen several earthquakes and fire in Los Angeles, and I hope my friends and their families and their friends are in safe situation. It's a life, it's a nature, and it's not all the time predictable. Huh? Okay. It's a traxes scheme. There is ICOM. Trying to go all the time to other territory. Yes, it's possible to protect this segment with the positioning the balloon in ICOM. Then the remodeling role of the balloon is less. I think there is a fenestration. It looks like there is a fenestration. The second ICOM maybe is there. Okay. Now it's look like we can go. Yes. Yes, now I'm mostly looking for lateral view because the AP view is less informative. And during the navigation of balloon, the gamma could move. That's why we need to keep our eye on the gamma also. That's okay. It's quite stable. Yes, that's why the biplane system is very helpful in such aneurysms. Yeah? Okay, we can leave it here. Let's do one more draw. The microcatheter is oriented down. It's not so good. It's better if it's oriented up. There is some spasm. Нема топ-кост поясан ше промывка smart mask. Okay, with echelon most of the time it's possible to rotate the microcatheter, but with gamma it's less possible to rotate, and it's a 45-degree microcatheter. We pre-shaped with the heat gun. Okay. Let's place the wire inside the aneurysm. The micro is going down. Okay, I think it's rotated. Yes, it's some problem here. Huh? Not sure what. That's a problem with the wire. Yes, the wire is broken. Okay. Tag chicken black person. Okay, I will change my chicken black. Yes. Maybe at some level it was damaged. I see anatomy and the back angulation. It's not so good. Yes, it's quite stressful for the instrument, and for the young physician it's also could be the problem to navigate easily the instrument in such anatomy. The tortuosity of the vessel is taking some part of the ability of instrument to navigate in such anatomy. Okay, I think now it's better. Нема топқосыңыз ба? Все, рахмет. Yes, and gamma is also lost the shape of the tip. Okay, let's place like a straight microcatheter. I will reduce my zoom to see the beginning part. Okay. Yes. I think it's lost the shape. Okay. Okay, now it's better. Okay. Let's navigate now to A1 segment. There is a step because of bifurcation. Maximize my zoom. Okay, it doesn't want to go. No, I think it should go. Yes. Okay, now it's went up. As the tip of the microcatheter is looking downstairs, and it's a little bit problem during the navigation of the first coil. The tip of the microcatheter will touch the wall of the aneurysm. Okay, now I think it's better. Yes, it's look better. During the implantation of first coil, I will pull a little bit the micro. Okay, I think we need to measure the aneurysm. Just a second. Okay. I need to measure the aneurysm. Есть еще, Саш? Бір секунд. Окей. Можно на этот экран переключиться. I will measure the last image. Okay, this is second contour. It's a part of the aneurysm inside the interpositioning the vessel. Okay, it's a 2x6 and 3x4, 2x6, 3x4. Так, екіде 6, екіде 8 берсаш, сарсын. We will take 2x8 microplex. It's a yellow one. Ашырыз. И оптима 1,4 берсаңыз. The first coil will be microvention Terumanero 2x8 yellow coil. It's an 18 system coil. And the second coil will be, we will see after first coil. Okay. Желтый отделок на коясыңыз? Sarsın. Okay. Okay, I will bring my microcatheter a little bit back, 1 millimeter maybe. It's just a 2.5 millimeter aneurysm. Okay, I think position is better. It's a 2x8 helical coil. Okay. Let's inflate the balloon. Yes, we can see the balloon on AP and lateral. Okay. It should be enough place. It's a 3 by 2.5 millimeter aneurysm. Yes, I think the next coil 1.5 we asked, and it's correct. Yes, and if you plan to place the stent, I think this shape of the coil could be enough if you place stent after. But we have no braided stents. If you will place something, it will be FD, silk vista. But I don't want to place FD on this session, so maybe just coiling. We'll see. I think there is no space. Okay, just a second. I think it's enough. Yeah? I think, and I hope it's enough. Yes. Okay, the coil is detached, and now we can inflate the balloon and take out the microcatheter. Okay, let's leave it like this. I'll keep it for a couple of moments. Balloon is deflating. Not so bad. Okay. Yes, everything is okay. Maybe some remnant at the neck level. Maybe not. There is no place for coil. Maybe if it needs stent, we can place stent at the next time if it's needed. But this result, I hope, acceptable. And patient is 68 years old. I think everything will be okay. And I think there is no need to increase the treatment risk. Okay. It's so-called endovascular hijama. I will doing my guiding to the common carotid. To create less confuse because of the flow from the syringe. It's okay. Aneurysm is closed. Let's do AP and lateral. As the surgery was on the left side, and it looked like good craniotomy. There is no, the defect is non-visible. MCA territory, ACA territory looks clear. Okay, let's see. AC is in place, MC is in place, no? Okay, everything is in place. Now I will ask Roland to do control CT. Какой персон? Okay, dear colleagues and friends, the CT is ready. Downstairs is clear. And this is aneurysm level. It's clear, and this is a level of previous surgery. I think it was bleeding, and at the time of open surgery of meningioma, we can see the clips. It was not so easy treatment, it looked like, but the result is nice. And the aneurysm level is clear. This is cranial fixes, and this is surgical clipses from meningeal artery, I think. That's look like. Okay. Yes, the meningioma level is clear. Okay. Okay, it was the only case for today. And Раванджер. Жень, пойдемте. А можете маску, колпак одеть, да? Асылжан, жүріңіздер. Жүріңіздер, медсестра, санитарка, бәрі қарыңыз. Мадина. This is a team. My assistants, Сағыныш, Раван, Асылжан, Мадина, Гүлназ, Назым, and Евгений. Всех видно, да? Бerdikhojayev, келіңіздер. Yes. It's a very small team for treatment of one case, and this is only case for today. I wish you enjoy the weekends, and for those friends who is in Val d'Isère now, enjoy Val d'Isère, enjoy French Alpine, and enjoy fondue and French cheese, and hope to see you soon. Bye bye. We are finishing the case. Okay, thank you. Bye.
Я там